Hey folks, thanks for jumping on. We will be starting in just a few minutes, so hang tight. Okay, Robin, you can come on as well. We can get started. Thanks everyone for waiting. So Perry and Robin, I'm mostly going to leave it to you guys. I'll be asking you some questions. For those of you who don't know, my name's Hannah. I'm the campaign manager here for Perry. Perry, I will let you open it up and take it away.
Okay, thank you, Hannah, and thank you, Robin, for joining us. So for everyone who doesn't know, my name's Perry Gershon. I'm running for Congress here in New York 1. I'm joining you from East Hampton at my house. Robin Gershon, Dr. Robin Gershon, is a noted epidemiologist at NYU, and she is joining us as our guest from New York City. And Hannah is broadcasting from Setauket. So we're in 3 locations. First time we've used this technology, so hopefully it all works. I appreciate everyone coming and joining us tonight. It's a chance for us to catch up a little bit about what's going on in the campaign, but to talk about what's going on in our lives. The coronavirus scare in many ways came out of left field. People knew something was going on, but it really wasn't until a week ago when a series of things happened, like Tom Hanks letting people know that he had the disease and some NBA players, and it just seemed like everything shut down. And we've learned almost on a daily basis just how serious this is. And we're all taking steps to try to ensure that we can, so they say, flatten the curve and make sure that we control the infections as best we can. But with that, and before I get to the campaign, let me just introduce Robin. Robin's an interdisciplinary occupational and environmental health and safety researcher with extensive experiences in the areas of disaster preparedness, health safety, and risk assessment and management in high work occupations. She earned her doctorate in public health from Johns Hopkins and School of Public Health, where she was on the faculty for several years. Let me hand off now to Robin to see if she's got some introductory remarks, and then I'll come back to just introducing the town hall. Robin, take it away.
Okay, thank you so much, Perry, and to Hannah and to all of you out there. I think it is so imperative at this time that we create our own community, sense of community. Right now, a lot of people are sheltering in place. Some people are self-quarantining. Some people are in self-isolation. So we're getting isolated. Right now is the time for us to use all this technology to bring ourselves together. So I'm happy to be here to answer your questions. My work is primarily in public health preparedness. So questions around that topic and what's happening in the US, I'm happy to help.
Great. Thank you very much, Robin. So the people are going to have many questions tonight. We have some that came in ahead of time. I'm sure there'll be live questions, which you can present over Facebook Live, or alternatively, you can email questions to cross, C-R-O-S, at perrygershon.com. And Cross will be able to get them to us. Hannah will be asking all the questions. So the questions will come in electronically, they'll go to Hannah, and Hannah will pose them in order. We're going to go till 8:30 or till questions end. If there are questions that you have that weren't answered tonight, email them to Cross or to myself, Perry at perrygershon.com, and we'll get back to you. I'm very good about answering people's questions. So, well, a few more ground rules for tonight. I am a Democrat running for the nomination. We have a primary on June 23rd, but we're going to try to keep tonight as apolitical as possible. People know my feelings towards Trump's presidency and towards Lee Zeldin, but I think tonight it's not supposed to be a political event as much as it is an informational event. So keep the gist of the questions that way. But suffice it to say, this is an election. The primary is on June 23rd. All of you should be, if you have not registered to vote, you still have time. It's past the deadline to switch your party, but you can still register to vote. So with that, let me introduce Hannah, and she will take it away from there. I thank you. Actually, one more comment on the town hall that I like to make whenever we do them. This is the 7th town hall that we've done. We've been holding town halls monthly since September, and all the previous ones have been live. Obviously, we've had to shift the way we present to deal with the crisis that's around us. But hopefully, this will go smoothly. People should feel free to ask whatever questions they want, either on coronavirus or on anything else. It's all fair game. We're not screening for a political party or anything along those lines. So it's an open microphone. I believe very strongly in the town hall format. When I was 10 years old, my congressman, Ed Koch, held a town hall that I took part in. And as a kid, I raised my hand. He recognized me to ask a question. And I asked him about a candy store across the street from my school that was charging 13 cents for 10-cent candy. And I couldn't understand what was going on. And I asked them about it. And they told me 3 cents of sales tax. And I said, that's 30% tax. Is that right? And Congressman Koch was nice enough to say he'd look into it. And sure enough, a couple weeks later, the candy store had reduced its price to 11 cents. And I asked them, and they said, well, it's 1 cent sales tax for the 10-cent candy. So something went right as a result of the town hall, and it left an impression on me. So I'm hopeful as your future congressional representative, I will be able to hear people's concerns and address them, and we will continue to do them monthly. So with that, take it away, Hannah.
Okay, thank you, Perry. So this question is pretty straightforward. It's from John, calling in from Brooklyn. He just wants to know, Perry, what your response is to fighting the COVID-19 pandemic.
Hi, John. Thank you for the question. It's a great way to start. So we're all taking steps in preparedness. We're exercising social distancing, at least we're supposed to be, where many of us are not going to work. We here decided not to all get together in one office to do this, but to show people how much apart we really need to be so that fewer people will become infected. We're not going to stop the infection. We don't have the vaccine for it, and we don't have an antiviral treatment. So all we can do is try to minimize the number of people who get infected so that we don't overload the hospitals. And remember, for most people, you will not have a serious case of disease infection if this hits you. But you may spread the disease to others. And for certain high-risk individuals, generally they say people over age 70 and people who have other underlying sicknesses, that they are more susceptible to what could be very, very severe circumstances, including death. And to put it in perspective, right now, Suffolk County has 152 cases of identified coronavirus, and 3 people have died. And in terms of where it is in this district, it's particularly bad as a problem. Southold has 33 cases. Islip is 23. Brookhaven is 20. So you've got a lot of people being affected, and we need to do everything we can to control the rate of increase. Robin, do you want to add anything to that?
And Robin, you're on mute, so you'll have to unmute yourself.
All right. Thank you, Perry. I think you summed it up really beautifully, and that was a great start out question from John. I mean, the case numbers are increasing at really an alarming rate, with several hundred now a day, and now we're up to 7,500 cases in the US all total, and about 114 deaths. Well, people look at those numbers and they say, well, we're a huge country, over 300 million. Why should we care? Well, as Perry pointed out, in some areas, we're starting to see some pockets, and we want to keep those pockets really, really small and not spreading throughout the neighboring towns and neighboring communities. It's spreading fast, and unfortunately, we don't yet have that vaccine, but there are some really good clinical trials right now that look very promising for antiviral medications. If we get those antivirals, things will improve dramatically, but until we have the vaccine, unfortunately, right now we have to depend on what we call non-pharmaceutical interventions. Thank you, Hannah.
Thank you, Robin. Hannah, you want to go to the next question?
Yes, I will do that. So this question is from Chris, who is in Greenport. And their question is, what are your thoughts on appropriate legislative responses to the economic situation small businesses are facing? Will the money that the federal government be sending to Americans include green card holders? And how can we help our undocumented neighbors?
Chris, that is a great question. And I'm going to give a general answer and some opinion, but I'm obviously a candidate, and I'm not on the front line in Congress. Certainly, we should be doing everything we can to give relief to as much of the population as possible. And that kind of relief includes testing, and we need to give free testing to everybody, because it doesn't matter if you're documented or not documented, you're absolutely the same in terms of your risk of becoming infected and infecting others. So that level of care, really we can't differentiate. In terms of giving relief, it's not clear yet what kind of relief is going to happen, other than we need relief. And I can say if we don't provide relief, the number of defaults at the small business and the big business level is going to be off the charts. It will stop society. So it's clear, our American life. So it's clear Congress is going to act in some way. The proposals that seem to be getting the most attention are giving some amount of money to each individual. And how we define who the individuals are is still up for grabs. Whether it's going to go to everybody across the board, whether there'll be an income cutoff, meaning higher income people won't get it, or whether it'll be steps so that people at higher incomes get less and people at lower incomes get more. You want to be sure that people can continue to make their rent payments, their utility payments, their tax payments to the extent necessary, because we don't want people defaulting. You also want to encourage lenders, wherever possible, not to foreclose if people miss their payments. We need to give people relief in time for society to start moving again. That's the gist of the legislation and what we need to do. And it should affect as many people who are in this country as possible. Hannah, you want to go to the next one?
Sure, absolutely. This next one is from Janet, and she said, I started working from home. How long do you think before I should wait before I'm in the clear? And how long would I have to wait before I start having symptoms?
Okay.
Janet, that's a great question. Robin, why don't you start with that?
Yes, absolutely. Thank you, Janet. That is a great question. So what they're saying now is that symptoms typically begin about 5 days after you've been exposed. The symptoms start out as either fever, usually over 100, and a sore throat, and then coughing, or some combination. But some people have just simply had a fever. Some people simply have the cough. And they're saying right now a 14-day self-quarantine if you're not sure that you have COVID or you think you've been exposed to COVID. If you have absolutely been diagnosed with COVID, then they're saying basically the same thing, 7 to 14 days. So I think within the next few days, it should become a little clearer. Absolutely, you should reach out to your provider. A lot of them are doing the telemed or phoning in. They absolutely don't want you to show up or show up at an emergency room. Now is the time for watchful waiting. Just wait it out and see what happens. And hopefully it will not happen to you. Thank you.
Robin, let me ask you a follow-up question to that. If someone is self-quarantining because they think they were exposed, what does that mean exactly? Can they go outside? Can they go for a run or a bike ride, or do they have to stay indoors?
Well, we've been hearing very conflicting things about this, which is quite confusing. But from what I've heard most recently, you can take your dog out for a walk. Now, this is if you're not symptomatic. Clearly, if you're not symptomatic at all. But if you're watchful waiting because you think you've been exposed, they're asking you to limit your contact with the other people in the household to the extent possible. You can take your dog out, you can take a walk, you can take a run, but you should still keep your distance, as all of us should be right now. It's when you're in self-isolation or mandatory isolation that you really cannot be in contact with other people in the household or with other people outside the household. In that case, they're asking, can you please get someone else to walk the dog? Can you make sure that your food is delivered and left at your door so you don't have to go out? Can you have everything delivered? And keep your distance from everyone else in the household. Now, being in New York, I live right here in Manhattan, that could be very difficult for a lot of people who are in tight, small apartments, have only one bathroom, for instance. In those cases, when you're in tight quarters and you're going to be in your self-isolation, you must practice incredibly good cleansing and disinfection of all your surfaces and keep yourself to yourself as much as humanly possible.
Great, thank you. Do you want me to go ahead? All right.
Yeah, why don't you go on, Hannah?
All right, cool, great. So this question is from Marshall. And Perry, I think you'll have something to say about it. How do you respond to someone calling it the China virus?
Thank you, Marshall, for asking that question. That is something we were talking about before we went on. If you call this the China virus, you're being racist, pure and simple, and you shouldn't do it. It's inappropriate. It gains us nothing. It offends people. There's just absolutely no reason for it. And I wish our president would stop. I think the president is here to exercise leadership, and good leadership is trying to get the entire country to be behind you, not insulting a group of people, a group of Americans, a group of foreigners. And this is the world's problem. It's not America's problem. It's not China's problem. It's not Italy's problem. It's all of our problem. And we're going to have to find a solution to it together.
Great, thank you. Okay, so This question is from Marilyn, and she's in East Patchogue. When the drive-through testing areas are open in Suffolk, what does one need to do to take them? Do we need a doctor's note or an ID? Is there anything that we need to be able to take a test?
Well, Robin, I'm going to let you comment a little more on this in case I missed something. But people should know that a testing center opened at Stony Brook today. And it started, today was the first day. You do not need a doctor's note, but you do need an appointment. And the number to get an appointment is 1-888-364-3065. And you'll get vetted by a health personnel. And they, if they think it's appropriate, will give you an appointment. You will drive up. You will get instructions when you get there. Today is the first day that we've had this in effect, so we're going to have to see how it goes. I've seen conflicting stories, whether the hours are 7 to 7 or 8 to 8. I would look at Newsday or other sources, and they'll be more specific. Unfortunately, Newsday today printed both, so I can't tell you which one is accurate. Robin, do you want to comment a little bit on mobile testing generally?
I think this is such a great advance. This is so important, and I'm so glad Marilyn asked this question, because this is a way that we can reach out to people in the community without having them come to hospital emergency rooms or their doctor's offices. It's much less risk for the people getting the sample. They can stay in the privacy of their car. And this idea of having appointments so it's not a backed up, winding line of cars is really great. And actually, I hadn't heard of that particular way of doing it before. There aren't that many places doing it, just a handful. I'm trying to think of how they would implement it in a place like Manhattan, for instance, where a lot of people, of course, don't have any cars. But this idea of a very simple, easy way to get tested, and of course, right now we're still really only using those tests where it's absolutely needed because we're so short supplied because of some lack of planning on the government's part. But this is a great way to use them, very targeted in certain areas. I think it's just brilliant. I think it's great that your community is doing that.
Great. This next question is from EJ in Sag Harbor. How long does COVID-19 last on a surface, such as a doorknob or such as something that's made of paper? Does it survive on one surface longer than another?
That's a great question, EJ, and people have been scrambling. Researchers, scientists who do those kinds of studies have been scrambling the last few days, and we're just starting now to get some of the results coming in, and they're publishing their papers ahead of press. The latest information I have, and this is in a very, very controlled laboratory setting, okay? So these numbers may be very, very different in a real, natural environment, say a household environment. But it seems quite clear, just as it is with SARS, that COVID-19, the agent that causes COVID-19, can last quite a while. It's remarkably hardy. They haven't tested against all kind of humidity and temperature levels and so forth, but it seems to last the longest on kind of stainless steel surfaces and on paper. On doorknobs, it's unquestionably can remain for a while, and that's why we have to practice very, very good, not only deep cleaning, but disinfection. Now, I was just in the store yesterday. I did a very quick run. I got in there, and the shelves where I am on East 86th were completely bare of any kind of cleaning, including, laundry soap. So people have been going after those supplies. We know that the supply chain is still intact for those kinds of things, not so much, unfortunately, for face masks or gloves. but for cleansers and disinfectants, hand gels, those are coming down the pipeline. The problem is as soon as they hit the store, they empty out. So now stores are implementing 2 or 4 per person so that it's not all run through. But I would say in the absence of having a good kind of Lysol or a Clorox that you can dilute down and use after you cleanse it carefully, thoroughly, with some kind of, even detergent, some kind of soap, get those surfaces, all of our tables, our countertops, our bathrooms, our toilet seats, our counters in the kitchen, the handles for the refrigerator, the microwave, the dishwashing, all those handles, all those surfaces, we should be cleansing them carefully first and following up with a good spritz of Lysol spray or some kind of Clorox spray. I'm using right now, because I'm out of Clorox spray, I'm using a diluted vinegar spray. I haven't seen yet how well it's working, but vinegar is a pretty good cleanser in general, but as soon as I can get the Clorox, I'm going to dilute that out and use that. That's a great question. Thank you.
Great.
Let me ask, Robin, I want to go back on the last question before this one. One of the things that Cuomo said last night was how important it will be as we go forward to test not as much who's infected, but who has antibody and who's developed the resistance to COVID-19, coronavirus. When people recover, are they going to be susceptible, or who is susceptible once many people have been infected? What do you know about what's in the development pipeline for antibody testing?
Absolutely. This is the next step. We're going to try and find out who's immune, who's been infected, and who's been cured. That's still coming, but when it does, it means that maybe, just maybe, we can start developing gamma globulin infusions like we did with Ebola, if you recall. We were able to use some few people who recovered and you get their gamma globulin and infuse it into other patients, and eventually that will happen. We just don't have that test yet, but it's certainly coming. It will come very soon, I'm sure. They're already working on those assays. But yeah, that's going to be critical. But right now, it's not so much that we have to test everyone in the community. We're past that stage now. What we need to do is find out who's coming into the hospital that's truly infected with COVID, because then they can really maximize their use of their personal protective equipment. If we just have it for everyone, we're certainly not going to have enough. So that's where we need to know. And also we need to know in these pockets where there are true outbreaks like nursing homes, we need to know who in the nursing home is positive so that we can isolate them from the ones that aren't and kind of cohort them with all the others that are. And then we have a watchful waiting until we know who has to go to a hospital. So that's where we have to use our tests. But yeah, those tests are coming, Perry. They're coming, and they will come very soon, and that will be a big help to us.
Great. Thank you, Robin. Hannah, you want to go to the next question?
Yes, and I also just want to make a quick comment for EJ and other people who are curious. The Suffolk County Health Hotline number is on our website. I figured it was a little bit relevant to what EJ was asking. So our website now has a coronavirus resource page. It's a lot of valuable information, local information. We're going to keep it very up to date. We have Robin's daily sort of updates on there as well for information. And you can just go to perrygershon.com to get that. So I wanted to just throw that one in there. Okay, so this next question is going to be from David. He's out of East Hampton. Without interventions, we might see up to 60% of Suffolk County infected by the coronavirus within a month and no hospital beds available. What measures do you suggest to control transmission and logarithmic growth, took me a minute, logarithmic growth of the number of infected persons?
I'm going to let Robin take most of it, but the first thing I can tell people is that's why we're practicing the social distancing. That's why we're staying home, not going to work, not joining large groups of people. I think the recommendation now is stay away from groups of 10 or more. And you're probably better off staying away from groups of 5 or more. the more of these practices we all follow, and it has to be everyone. It can't just be people in the high risk group. It includes my children, people in their 20s, probably especially people in their 20s, who are going to spread it the most. Stay inside, keep yourselves to yourself and to tiny groups as much as you can until the guidance from the government and the experts tells us it's okay to go out and do differently. That's my advice. Robin?
That's great advice, Perry. That's basically all we can really do right now. We have to depend on social distancing, school closures, university closures, bar and restaurant closures, workplace closures, and of course, people over 65 or even 60, they're saying now to do this shelter in place. And of course, anyone with a chronic illness, underlying illness to, of course, also shelter in place. But getting back to what's going to happen, well, what's going to happen is this, David, 80% of those cases will be extremely mild and it will probably be asymptomatic for many of them. The latest data out of South Korea is showing us that many of their positives, a huge proportion, were completely asymptomatic. So it's only going to be that very small at-risk population, generally the older, the chronically ill. Now we're starting to see a few healthcare workers who are in close proximity, but it will be a very small proportion that will then need hospitalization, much more intensive care, ICU beds, ventilators, the whole thing. The good bright spot in this terrible worldwide pandemic, we can never say it's any one country, it is a worldwide corona, is that it does not seem to really harm children, especially very young children. Even if they get it, they seem to get it the same rate as adults, they get it much more mild. There has not been a death, to my knowledge, of anyone under the age of 9. Teenagers that get it have a mild case. It's mild in that younger group. The reasons are still to be determined, and that is our bright spot. So no, I don't think we should panic. There won't be enough hospital beds. For the vast majority of us, we can just weather it out at home. Thank you, Hannah.
Great. Thanks, Robin. So this is a question from Marge, and it's for Dr. Gershon. Robin, can you comment on the World Health Organization tests and why the US did not access them? They also want to know how this coronavirus, so 2 questions, how is this coronavirus different from SARS and H1N1?
Oh, it's very different. Thank you, Marge. Those are great questions. It's very different from H1N1. For one thing, it is, look, we get a lot of deaths every year from seasonal influenza. We get between 20, 30, 40, 50,000 deaths a year. We get a lot of deaths, and they're mainly in very, very young children and very older people and chronically ill. This is very different. This virus is acting very different. It's not attacking, thank goodness, in a very serious way the very young. It is unfortunately attacking the very old. But insofar as SARS, we were so incredibly lucky with SARS because SARS burst onto the scene. It was very prevalent in Asian countries. It got into Canada very quickly. It caused a lot of havoc in the healthcare system in some parts of Canada. It was spread remarkably readily to healthcare workers. It was very, very contagious, kind of similar to this corona, which is in the same family as SARS, but remarkably, all the efforts we put into play at that time stopped that outbreak. It was almost magical. We had a lot of cases. All of a sudden, all the cases came down. Now, a lot of people think it was because of the social distancing and all the incredible effort that we put at the time, but the US did not have a lot of cases of SARS, and it went as fast as it came in. This one is different. This one is unfolding country by country, city by city, town by town. And it's very contagious. It's also by contact, the way SARS is. So it's contact and droplet spread. So it's spread very efficiently. But insofar as what happened with the WHO testing, that is $1 million question. And to this day, I really simply do not know how our CDC did not jump on this immediately as soon as they saw this happening, as we saw with SARS. And you know, during SARS, we never did develop a vaccine. In fact, I think it's still an experimental vaccine. We did not have a lot of things at our disposal, but here is a case where we've had what up till now, and maybe still is, the #1 world's experts in public health and public health response at the CDC. I mean, CDC is just was always the national leader. We are #1. We're probably still #1. But why they didn't jump on this immediately, I have some thoughts about it. I've heard from a lot of my colleagues, and I know firsthand that they lost a lot of their incredible leadership at the CDC under this last political system that we're in now. We lost them, they fired them, they let them go, they moved them out, and they were not only institutional memory for how do we handle things like of this nature, but they were world's experts in pandemics. So we lost that incredible talent. And I don't believe that maybe the ones that came in to fill those roles were really quite at that level, and that may be part of it. I don't know. I mean, I know the National Security Council was disbanded under our president now, and they had a tremendously influential at the highest levels of government to take this on as if it was any national security threat. And those people were let go, that was disbanded. So we've lost a lot of incredible leadership at the top levels, but CDC absolutely should have been either making their own test kits and making them right and ensuring that they were right, or making sure we had what we could get from the WHO, and that simply just did not happen.
Let me add one thing to that. As I said in the beginning, this isn't a forum about placing blame and looking for repercussions. It is quite clear that our response was slow, and we could and should have done better. And I find it most unfortunate that the president isn't owning up to responsibility for it, because it happened on his watch, and he's ultimately responsible for everything that happened at the level of the CDC. And we did make mistakes. We should have taken the WHO test here, and we'd be much further ahead of the curve. But having said all that, doesn't matter. We are where we are today, and we need to move forward. We need to do everything we can to stabilize things and ultimately pull out of this epidemic with the minimum damage done to the country. And then if we don't like Donald Trump and want to hold him responsible for it, we can do that in November. Now is not the time to be attacking a political party or a political decision. And now is the time to figure out how we're going to recover as a country.
Well said. Well said, Perry. I agree. Well said.
This question is from Eileen. Can Perry talk about possible small business help for those businesses that will be forced to shut down? What are their options when they don't have revenue?
That too is a great question. And in terms of how do small businesses cope, that is where the federal government and state government too really has to come in to help. We need to provide, in my opinion, as much relief as possible so that companies don't default. And it's a two-way street. You need small businesses not only to stay in business so that when we emerge, they are able to function again, but they employ people. And we don't want to put the people who are employed in small business out of work either. We all have to grit our teeth, make some sacrifices, and not take down the whole in order to maintain the greater good. And I think that's got to be the focus of policy. That is why Congress is talking about paying money to people and probably giving some relief to small businesses too, to keep them in business in the long term. I want to talk about one conversation I had yesterday with a business owner in Port Jefferson who makes inflatable boats, which is a somewhat medium business, and he imports them from China. And he has struggled under the Trump administration for a series of reasons. First, with the tariffs that made it too expensive for him to put his product together. He needs the parts to come from China, so it wasn't something where he could just make them in America anyway. The parts aren't made here. But he started finding other sources, and then he was granted an exemption from the tariffs and able to manufacture in China. And then China shut down. And China shut down because of their coronavirus outbreak, and he couldn't get product. And now, as it looks like China's going to start resuming doing business, he's got other concerns here about how does he get his product here? How is he going to be able to ship it? So at every level of business, there's an effect of what's going on in these chains. And we have to be cognizant about it. The tariffs had real effects on people here in Suffolk County, and that's not over yet. And coronavirus is going to have real effects at people, small and big, here in Suffolk County. And we have to be aware of it and take whatever steps we can so as not to imperil people's businesses. Because there will be a day, hopefully in the next month or two, where we can emerge and start trying to resume our lives again. And it will be a complicated environment. There will probably be excess demand because people have been cooped up and no one's been buying anything. So everyone's going to want to go out and buy product and make product. But our supply chains are going to be off. So you'll have shortages just because the supply capacity won't be able to keep up with demand, which is something similar to what we had after World War II. So it's going to be a complicated process to form a new equilibrium, and we should all be sensitive to it.
Okay, thank you. Okay, I'm going to go back to a question about tests. We hit on it a little bit earlier. This question is from Kim. What is going on with the lack of tests? Even Congressman Lee Zeldin said, we keep being told we will have tens of thousands of tests coming, and then Vice President Pence said, we don't have that many coming. We need hundreds of thousands of tests. When is that going to happen?
Oh, that's another $1 million question. And it really is, I think it's truly unconscionable that we were not prepared for this. This is not about politics or anything else. Any country, a developed country of this size, of this importance to the world economy, to not be keeping our eye on changes occurring in other parts of the world, because we are such a global world now. People can be in one place within hours, another country. That's just the nature of how we are now. So we have to be really watching and paying attention to trends and things occurring that are happening in other countries. So the problem with the test, from what I could tell, is of course we were out of the gate very slow because the first batch that the CDC made had some kind of problem with one of the reagents. So then they had to go back to square one and start making them again. And then we were slowed down because they were holding on to those tests, the few that they had, and it's not clear, was it 10,000, was it 8,000, whatever the number was, they were holding on and they were letting them go just to very few areas that were requiring them, requesting them, and whatever test they were doing locally, say at the New York Health Department, upstate New York Health Department, which is a fabulous health department, one of the best in any state, they were doing the swabs, they were getting the specimen, but they had to ship it to the CDC, or even once they had their own test developed, they had to have it confirmed by the CDC. Now, the New York State Department of Health has more than enough capacity to, of course, conduct their own testing. They do it for any number of agents all the time. But that was a bottle gap, that was slowing us down. But now the problem is that it's the same thing as Perry was saying with supply chain. They need certain reagents. They need it packaged. They need a packaging of it. Now, fortunately, other companies are jumping in, LabQuest, all these firms are coming in. They are very well equipped to do mass testing on massive scale, and they're stepping in. And I think now some of this bottleneck will slow down. But as we said before, right now we have to reserve what we have for hospitals so they can know who truly is infected. And we can reserve it for these small outbreaks in nursing homes and try and keep those contained in other communities where we seem to be having a lot of spread. But I think they will start to roll out, and not because of our government effort, unfortunately, but I think because of this private company effort that's going to fill in the gap, and more of these health departments will do it on their own. So I think within the next week or two, things will start to loosen up a bit. Thank you, Hannah.
One of the things that's made this so difficult, and I think this questioner had it right, we've been given such misinformation. Trump went on TV a series of times and said there's plenty of tests available for everyone who wants it. And that was blatantly not true. And we have this administration where it's not considered okay to say the president made a mistake. And the president never likes to admit when he makes a mistake. So Pence was having trouble explaining to people, no, we didn't have the test available. And we're past that. We've got to get past that. But that's why this was as hard as it was. I wrote a piece about leadership that is in the Long Island Advance this week. And it's also online on our website if people want to see it, and on our Facebook page. But the point is on testing that South Korea, as of last Sunday, was testing 20,000 people a day, and we had not tested 20,000 people in total. That is such an imbalance, and we're in a catastrophe, and we're having to pay the price for it. We need to do better. I believe we are doing better, and we're going to see it in the weeks that follow. There is finally real evidence that the testing is coming.
Yeah, I agree.
Okay, so Perry, this one's from Paul. Paul is asking, what is the latest at the airports? I'm getting conflicting information. Is there a risk that all entry will be closed between Canada and the US?
What I heard this morning from the president's tweet and also reports on CNN is that we are closing the US-Canada border to normal traffic. There will still be trade allowed to come through and necessary traffic, but you can't, as an American, just wander into Canada anymore, or as a Canadian come into the United States. And we're seeing really worldwide countries having to shut their borders. Even within Europe, within the EU, the individual countries that had completely open borders are having to close them now temporarily to try to get their own health environments under control. We're going to see this for some period of time. I heard an estimate of 30 days, but my gut is that 30 days is going to end up being longer. That's not like longer a year, but it's longer, could be 60 days. Who knows? But again, the hope by closing these borders is that it will limit the amount of spread from one country to another. And the more you can isolate and limit the zones of infection, the better. It's just one additional step. It's like we're putting ourselves in our homes right now. Countries need to put themselves within their country, but we still have to allow trade because the world is interdependent on each other. The US needs to get deliveries from Canada, from Mexico, from Europe, from Japan, from China, just for parts or even for whole components that we rely on. And if that trade goes away, everything shuts down. So when they say close the border, they mean close the border to tourism, to common traffic, but not to trade and essential traffic.
So I've heard, if I could jump in here, I heard that Delta, or is it Delta? No, I think it's United. I saw it, I guess, last night. They're going to cut 60% of their flights. So I think we're going to start see airlines starting to close down certain runs, certain flights. I think air travel is going to shut down, maybe not entirely, probably not entirely like on 9/11, but I think it's going to contract considerably. And I think it will be soon.
Just one more comment. What we saw over the weekend really can't repeat itself again. When Trump said he's going to shut air travel or all travel between the U.S. and Europe, that was a call for Americans to come home. And Americans did come home before the travel shut down. But the problem is we weren't prepared for it at the airport. We didn't have enough personnel there to rush the people through and keep them separate. So while we're preaching social distancing, we're packing together travelers coming in from Europe who are, in our minds, the most at risk, and we're packing them together to infect one another. So that's an example of what we have to do better on going forward. For every action we take, there's a reaction, and we need to prepare for it. That's the forward thinking necessary. And let me go back to citing Governor Cuomo for some of what he said recently that I think is notable. He talks about how New York can't do certain policies alone, because if you put a rule in place in New York, but not in New Jersey or Connecticut in the tri-state area, people will just cross the border, go to the other state, do whatever, and come back. So our states that are in tri-state areas adjoining one another need to work together and coordinate in policy. And fortunately, we're seeing that in the Northeast, and it's just another example of Cuomo doing a great job in his leadership.
Perry, you make such an important point here. In the absence of federal leadership, what's happening, what I'm seeing is that the governors, the mayors, they are stepping forth and they are taking steps. For instance, everyone was free for all in all the grocery stores. Now they're starting to space it out. So it's acting at a local level, at a state level, but you're absolutely right. I think Governor Cuomo has shown remarkable leadership. I think de Blasio has shown great leadership. I think they're stepping in to fill the vacuum at the national level.
I'm going to tell a little bit of a human story here. I mean, people know I have, and many people know I have two sons. My son Logan is here working on the campaign. My son Marshall is a junior at Tulane in New Orleans, and his school, like I think every school, has shut down when we'll be moving to online classes. And Marshall said he'd like to stay in New Orleans with his friends. And I had concerns about it as a father, about what was going on and for his safety. And we had a conversation Sunday morning where I said, Marshall, you should think about coming back here. If you're going to drive or drive with people, you should probably do it sooner rather than later, because who knows whether the roads are going to stay open, whether the gas stations are going to stay open. I want, as a dad, I want to get you back here as soon as possible, and so that I know you'll be safe. And it made me feel good because Sunday night he called me up and said he's coming home, and he's on his way now. He's already in Bethesda. So, and he'll be here tomorrow. So those are the steps I think we all need to take care of our families, to take care of our loved ones around us. And that's part of being human.
Absolutely.
Okay, so this is a question from Joanne. She's saying New York City has no rent payments for 2 months. What about Suffolk County? Harry, if you have any info on that.
I haven't, honestly, it's the first I heard that New York has waived its rent payments, but
I haven't heard that.
Yeah.
I can't comment on that. I don't know if that's correct or not. It may be, it may not be. But in terms of Suffolk County and people who live here, I mean, we don't want anybody to be evicted in this crisis. There's nothing that could be more harmful than evicting people in a crisis where they're supposed to be staying to themselves, exercising social distancing, not being thrown out in the cold and hanging out with other people. You want them inside, not outside. So one way or another, we're going to have to find a way to give rent relief. Now, I'm not sure if that means free rent or if it means giving people subsidies so that they can make their rent payments. There are different mechanisms to get to the same spot, but you absolutely cannot be evicting people right now. That will be harmful for the overall problem that we're trying to solve.
So Perry, this question is from Elaine. She's asking, would you support paid sick leave? Would you support the paid sick leave, I guess, bill that the Senate is currently holding up?
Okay, thank you, Elaine, for the question. As I understand it, about an hour before this call, the Senate finally passed the House bill. So now it's on to the president for signature. So certainly that's a good thing. And to take people back, on Friday night, the House passed a bill that did a bunch of things. Among them, it provided for free testing for everyone for coronavirus, so that we wouldn't have impediments based on people's ability to afford the testing or people's insurance, keeping them from getting tested. And that's a critical step number one. It provided for paid sick leave and family leave, and I'm going to go back to that. It's billed as giving 14 days of paid sick leave, which I'm absolutely in favor of. It extended unemployment insurance benefits. It provided for better access to food stamps or those payments for people in the most need, and better access to Medicaid for our states. What it did not do as well as it could have was provide paid sick leave to everyone. It carved out companies that employ over 500 people, and there were certain other exceptions in there as well. And that weakens the bill from what it should be doing. I would much prefer to have seen a bill that did everything, that gave paid sick leave to everyone. And I hope Congress will go back and write a new bill and pass it, or in the next bill that they do, include paid sick leave for everyone. But right now, the priority was getting the other stuff done. And if you couldn't get everything you needed in the first try, let's pass what we can and then come back for more in the second try.
Great. This question is from EJ Perry. I work in New York City and commute in, and I take the subways. What is the best way to protect myself?
EJ, that is a great question too. I've not been on the New York subways in a few weeks, so I don't know exactly what the subways are like today. I imagine, having seen some pictures, they're certainly not as crowded as they were. But if you go back to the comments that Robin made, it's not just a matter of contact with people, it's a matter with contact with what people touch, the metal. The virus can live on the metal. So you really need to take precautions to effectively disinfect yourself as you get off the train, because you've been touching whatever that's on the train. And most important, and this is part of the behavior modification for most Americans, and it's especially true for subway riders and people who ride in public places, you shouldn't touch your face. The more you touch your face, that's how you communicate the germ that you pick up on your hand to your face. When you touch things, you've got to disinfect, go wash your hands, And if you're washing your hands, be sure you do it with soap water for 20 seconds or more. As the guidance, and I think it's very important. And having said that, let me turn the question over to Robin, who is in New York, and will be able to say more.
Yeah, I've been thinking a lot about subways. I've been talking a lot about subways. I've been riding a lot of subways, although I think I'll be cutting back now. But I was on it as recently as 2 days ago in the city going down to Washington Square. There are very, very few people on the subways. It's remarkable. It's a sight that most of us have never seen, maybe 5 or 6 people in a car, 10, 20 people on a platform. There are ways to protect yourself every step of the way. The first way that I've been doing is I'm just wearing regular leather gloves. My gloves are my subway gloves. So I put them on as I leave the house. I take one off to get my Metro card. I put it in. I get on that car. I put my glove back on. Then once I'm in the car, I try and sit, and you can sit. There are plenty of empty seats, so I don't have to touch any poles. If it is crowded enough that you need a pole, and I don't think it will be, you can use the crook of your arm to get your arm with covered arm around the pole. And then, of course, as soon as you get off, I get off. I take off my gloves. I put them in a baggie. I use the hand gel. I get to the office. I'm touching now every surface with a pull-out Lysol wipe. I have a canister of Lysol wipe that I keep in my book bag. I pull out the Lysol wipe, I open the door, I go in, I hand wash, as Perry said, 20 seconds, and then I feel I can go in my office and everything else seems okay. I mean, it's a lot of steps, but I think it's worth taking. You don't have to touch pretty much anything. You really don't. Even the turnstile, you can use your arm to get through the turnstile. So I think it's best to try and keep your hands away because it's very hard not to be touching your face. It's really hard. We can try, we have to absolutely try, but it is hard. If you start paying attention to it, it is hard.
Okay, the next question. Oh, I'm so sorry, I lost my place. And now I've lost it. Oh, Jacqueline, sorry, I apologize. So this question is from Jacqueline. She asks, China supplies a lot of prescriptions. Can you talk about that?
I'll take it, yeah. This is a tough problem. And you know, this was brought home so acutely during the 2018 storms in Puerto Rico. Because during that time, and still to this day, Baxter Pharmaceuticals was making the IV bags that we use in our hospitals. They lost the power in Puerto Rico, they lost the power grid, everything was shut down. Our supply was incredibly damaged and we had terrible shortages of IV bags, very commonly used in our hospitals, healthcare, throughout healthcare. So what happened next is that we didn't learn from that problem. We didn't learn at all because we still outsourced all of our face masks, our N95s and our surgical masks, for the most part, are made in China. Our medications are made in China. Now we have a lot of drug companies, of course, in the US, and they have manufacturing capability and they are switching right now to not only make drugs, but a lot more face masks right here in the US. But this is a problem. I know we are a global economy and we outsource a lot, but not having backup for these critical elements like medications, face masks, ventilators, respirators, gloves, disposable gloves, gowns, whatever it is, we need to take control of these critical elements in our society now. This is not going to probably be the last pandemic that we'll see. We have to get much smarter about how we're going to face the next one. And one way is to take charge of our critical infrastructure, bring it back to the US or ramp it up in the US. We can still do all of our trading, of course, and get our drugs elsewhere, but we've got to take control of these critical things. Right now, I don't think we're having those supply chain problems. I have not heard of it yet. Maybe Perry has heard, but I have not heard that we are running out of anything except, I heard, antibiotics. But I think our own robust pharmaceutical industry in the US can maybe pick up the slack on that, I'm hoping.
That's a great answer, Robin. And what I can add to that is, if you're concerned about supply chain interruptions from China, and probably the worst thing you can do is call this the Chinese virus or the Chinese coronavirus, and create further problems between us and China. We're in the midst of a trade war, which is hurting both of our economies. And I don't think it makes a whole lot of sense. I'd like to see it come to an end as soon as possible. The more interdependent we are, the worse it is to have trade wars and disturbances like this. If you want to make everything in America fine, but those aren't the policy, and maybe not fine, but if you do want to, assuming you do want that to be the case, you have to have all of your other policies follow that. So if you're encouraging pharmaceutical companies to make their products overseas, you can't then put big tariffs on and start trade wars with our trading partner and hope there won't be consequences here. And then you add a disease crisis like we have to the other trade problems, and it makes it that much harder. In terms of the, I'm going to say travel ban, but it's not really the right term, between us and Europe right now and the closed border between us and Canada. That's hard, and we need to, one of the things we've learned is Trump said he's putting the ban on with Europe, as he first said he was putting a ban on trade too. And that caused an immediate crash in stock futures. And he had to walk that back before it was done on television. So trade, people realize it is critically important, and we have to keep trade going. It's scary that we don't have alternate channels to the extent we don't. And we have to be careful with how we deal with our trading partners, because we rely on them. And it's a two-way street. They rely on us too.
Great. Thank you. So Perry, this next question is from Elizabeth. Please explain why the testing is so important.
Elizabeth, thank you for the question. It too is a great question. So testing was most important to start, because the more you test and can identify cases that come into this country, the more you can do to prevent the spread of the disease. It would have been great if we could have contained coronavirus before it got out into the general population. Because we couldn't test properly, we didn't know who had it and who didn't. And there were cases of people who clearly had the disease and were spreading it who showed no symptoms. And that put us much more at risk. So our ability to test is important because it allows us to isolate cases. And Robin talked about that a lot already. If you've got a nursing home and you want to isolate the sick person who has the disease from the other people who are at risk, you want to go and do the testing so that you know who the sick person is as soon as possible, so that they're not infecting others. And then you can expand that to other situations. Robin, do you want to comment on that further?
I think you got it right on the nail on the head. It's right now we've passed that point. Unfortunately, if we had had those tests early on, we could have identified the few cases that were coming back from other countries, for instance, really isolated them, put them in self-isolation. But we were late on that. And now we have to reserve the tests we have for the healthcare, for these pockets in Washington State and in Westchester, and reserve them for really diagnosing people at this point.
Okay, so we are gonna shift gears a bit. We're gonna move on to some questions about other pressing issues that are still weighing on people's minds, and some of it is certainly related. This question is from Rosalie Berry. She's from Brookhaven, and she wanted to ask, how would you implement an effective way to control the cost of prescription drugs?
Thank you, Rosalie. That is a great question, and it's something I've been talking about a lot throughout the campaign. Going back to last summer, I spent so much time talking to people at fire department barbecues and outdoor street fairs about what their biggest concerns were for Long Islanders. And one of the things I heard the most was the cost of healthcare, and often specifically the cost of prescription drugs. There are many people who either don't have health insurance or don't have sufficient health insurance, so they can't afford their prescriptions, or they can't afford the copays that come with their prescriptions. And they either don't take the drugs that they need, or people don't take the proper dosage of the drugs that they need because they can't afford the right dosage. And that's just a horrible problem to have in what's supposed to be an advanced society. Everybody should have healthcare, access to healthcare, and be able to get the prescription drugs that are prescribed for them. So how do we fix the problem? The most important thing we can do, because we have a capitalist economy, we have producers negotiate with suppliers. In this case, the biggest consumer of prescription drugs is Medicare. And Medicare is not allowed to negotiate prices directly with the drug companies. With that ban on price negotiation, the drug companies effectively gouge Medicare. They charge more than they should be because Medicare doesn't have, it has their hands tied behind their back and can't exercise their buying power. So the most important thing we can do as a country and as a Congress, and what I'd like to see Congress do, is allow Medicare to negotiate prescription drug prices. Now, the House passed this bill. It's known as H.R. 3, and it gives Medicare the right to negotiate. We need to get that bill through the Senate and signed by the president, because that is how we bring down prescription drug prices. There are other steps, too, you can take that will have an effect, but if you really want to do something about it, let Medicare negotiate directly with Big Pharma. And why wouldn't you stand for that? Drug companies make enough money. They will still be able to do the research that they want to do and need to do to bring out new drugs. It is crazy to say that if you control prescription drug prices, you're going to lose access to new drugs. Companies will still look to bring out new drugs because that's how they make money. That's what businesses are there to do. But you've got to allow the buyer, Medicare, to negotiate properly. And so H.R. 3 or prescription drug pricing plan is just a critical policy. And I think it's really unfortunate that Zeldin, our congressman, voted against that in December. It just was not the right thing to do. Hannah?
Yes. So this next question is from Adrian, and they are from Flanders. How can you help the Hamptons, middle and working class people, sustain a decent life, continue to reside in the area, and close the gap between the 1% who are barely making ends meet, and really end the fear and insecurity that our hardworking, law-abiding Latin American neighbors have to live with?
Adrian, that's a great question. We need to do more to improve, to deal with income inequality in America. Before the coronavirus situation, it was probably the biggest overall problem that any of us are facing. When you have a society that the rich get richer and you have the haves have even more and everyone else has less, it doesn't work. It doesn't work over the long run. It doesn't work over the short run. And what's happening on Long Island is that it costs too much to live here, so people are moving away, particularly young people. And the more young people we lose, the harder it is for our society to function. And there are different steps we can take to make things better. In terms of your question, we need more affordable housing in the Hamptons. We can't have the trade parade where we import a workforce. That doesn't work. We need local people to be able to live locally, and that means our school teachers and our firefighters and our policemen. But it's also true in other parts of this district. It's not just the Hamptons problem. People in Brookhaven need to be afforded to live there, and their cost of living can't be lower than the wages that they're making. And too many people in America are working 2 jobs and 3 jobs just to barely make ends meet. We need to bring better paying jobs into the region in order to advance the economy and in order to make income inequality less of a problem. How can we do that on Long Island? Well, one of the ways is to try to promote a clean energy economy. If we can bring a business, a manufacturing business with good paying union jobs back to Long Island, we will really do wonders in promoting the economy. We desperately need infrastructure work here. So let's get some infrastructure money in, and that will create better paying jobs for people, and that will make it easier to live here. We need a fairer system tax-wise. What we did in 2017, reducing taxes for people in the highest bracket, and really doing nothing for people in the middle, was unconscionable. It just took a bad problem and made it worse. So we need to take steps in the other direction. The people who can afford to pay higher income taxes should be paying it, and the people who can't should not be. And I'll cite a particular problem here on Long Island, which is the SALT, the state and local tax deduction. It used to be that Long Islanders and New Yorkers, and anyone in the country really, were able to deduct from their federal income tax whatever they paid in state and local taxes. The average state and local tax here before the tax change was $17,000. When they made the tax change, they put a $10,000 cap on how much state and local income tax could be deducted. So the average member of New York, person in New York 1, lost $7,000 of federal income tax deduction, which means they had to pay taxes on $7,000 more tax, taxes on $7,000 more income. That's a problem for most of us. And the people who were hit the hardest are the ones in the $100,000, $200,000, $300,000 income category. Not the highest earners. They got the breaks already, and then it doesn't affect them. But it hurts people with good paying union jobs who should be able to afford things. It hurts our policemen and our firefighters and our teachers. And that's just not right. And in December, Tom Suozzi, who's the congressman just west of here, and Peter King, who's the other congressman just west of here, Democrat and a Republican, introduced a bill in the House that would get rid of the SALT cap. And Lee Zeldin voted against it. And again, I have a problem with that. We need to get rid of the SALT cap to make it fairer to live in New York. We're effectively double taxed right now. And that's just not right.
Great. Thank you, Perry. This next question is from Mark from Bellport. If you are elected to represent New York 1, what is the first bill you would like to sponsor or co-sponsor in the House of Representatives?
Thank you, Mark. That's a great question, and it's one that would come up frequently when we used to do candidate forums, but before the coronavirus shut everything down. There are a lot of important priorities here. We desperately need affordable health care and a prescription drug bill. We desperately need to protect our environment, our water, and our air. We need affordable housing. We need fair tax structure. We need to do something for gun safety. There are just so many things that we need to do. And what's the most important one? I'm actually going to go off the board on the priorities and say campaign finance reform, because without that, it makes it harder to get to all these other priorities. The biggest problem, or among the biggest problems in Congress right now, is that outside groups and corporate groups have way too much influence. So they're good policies that our congressmen and our senators should be voting for, that they know they should be voting for, but they're not because of the money they receive from special interests. So we need to make our election process fairer so that we're able to get the bills through that will really help. So to me, campaign finance reform, limiting the influence of outside money, is the most important thing we can do first, so that we can pass all of the other good policy that we want to get through.
Great. Okay, so we've just got one more question to wrap it up, and it is coronavirus related. And it's an important one. Chris from Greenport asks, what symptoms should propel someone to call their doctor? Who should they call if they don't have a doctor?
Robin, why don't you start in terms of the symptoms, because you're more expert in that than I am, and then I'll try to wrap it up.
Okay, with the phone number, because there are different hotlines going up in case you don't have a doctor. The main thing that we seem to have seen so far is either starting with a fever and it's over 100 and it lasts for a couple of days. It can spike. It can go up to 101, 102. Oftentimes there's a sore throat, some coughing, some sneezing, some kind of stuffiness, and typically the fever will come down if you take some Advil, but there might also be aches and pains. Now, if this goes on for a few days, you have a high fever for a day or two, definitely you need to call your provider. That's a sign to at least let them know. Maybe, hopefully, they can rule out some other things. Around this time of year, we still have a lot of cold virus. We have influenza, seasonal influenza. There are now allergies kicking on. So they can help you determine if this is something really that needs to be tested, something that you need to go to an emergency room or into a doctor's office to get a sampling. But it's typically a little bit vague. It's fever, throat, sore throat, aches and pains, some chills I've heard, stuffiness, sneezing, and then of course shortness of breath, which is a very clear sign so far for this disease. Perry, what would you like to say about where they can get help if they don't have a provider?
There are different options depending on your situation. If you think you have coronavirus, you're running a fever, you're very concerned about it, the one thing you absolutely should not do is go into the emergency room, because that will put you in contact with the other people who are there. That is the first priority. What you should do is call the hotline number, and I will read it again. It's 1-888-364-3065, and you can schedule a test at the drive-through center at Stony Brook. And you will speak to a professional on that number who will be able to give you some advice and better tailor what the proper action is. I'm not an MD, and I'm not a healthcare expert, so I'm certainly not going to tell people how they should treat themselves. But getting the attention of a healthcare expert is important, and the government is telling us that they are going to see that your costs get paid for coronavirus. To the extent everything has not passed yet, I do believe it's going to pass, because there is seems to be a collective understanding that we have to deal with this, and that the problem affects all of us. It's not limited.
know this, I'm not sure, but on the drive-through testing that people go through, are they collecting fees at the time or on the phone, or how's that working? Does anyone know? Because I'm kind of curious.
It's my understanding, and I don't know this for a fact, but it's my understanding that the state is picking up the cost, that people are not supposed to be billed for it. I imagine they will ask you if you have insurance, and if your insurance will cover it, they'll try to put it through to the insurance company too. But if you don't have insurance, that should not be an impediment, and they are not supposed to charge you.
That's great to hear. Thank you.
Hannah, do we have any more questions, or should I wrap it up?
We're out.
Okay, so I want to thank everybody for doing this. It's the first time we've done this format. I much prefer doing these live and being able to see people come in, shake people's hands beforehand, but we're having to adjust what we do. And we're not going to be shaking people's hands for a while now. So I think this is a good way to communicate. We're going to try to do another one of these in April, 3 weeks, 4 weeks, something like that. But in the meantime, one thing I'd like to point out is, and the question didn't come up, I was ready with this answer. We can do things for our fellow humans here, our fellow residents of this district. And for example, in Mastic Beach, there are people who are not working, not able to get food, and we have food banks set up. Go work, put in a call, or investigate Long Island Cares and Long Island Harvest, who are setting up these food banks. I'm sure that there are many of us on this town hall who would be able to contribute food to a food bank. This is the time that people are hurting, and we all need to do what we can to help out our fellow Long Islanders, so that we're all able to pull through. That's got to be the goal. We are all in this together. We're not Democrats and Republicans. We're not immigrants and documented and undocumented. We're all Long Islanders. We're all in this thing together, and we've all got to pull through together. So that's the way I'd like to conclude. I want to thank everyone for joining. Follow our website, our Facebook, our Twitter, and you'll be able to get more information as we go on. We will be doing more of these events, and thank you.
Thank you. Good night, everyone.
And Robin, especially
pleasure.
Thank you for joining us.
Not at all.
I really appreciate it. I don't remember if I said this in the beginning or not. Robin is my aunt, so I'm particularly appreciative to have family stepping up too to help out. Thanks a lot.
My pleasure. Good night, everyone.
Thanks, Perry.
Thanks, Hannah.